Hey, what's up, everybody? Welcome back to another episode of Health Made Easy. I'm your host, Dr. Jason Jones, your practical voice in a world of confusing health information. And today we're going to continue our series on lowering stress for optimum health. This is actually going to be part 2. And if you missed the one that we did on the vagus nerve, why it's important for you, how it helps lower stress, what does it do, what are its functions, you're definitely going to want to go back and listen to that probably before you listen to this one, because today what we're going to talk about is we're going to be talking about something called vagal tone. This has been massive in the research recently. Many people certainly in the natural health world are talking about vagal tone. But there's a reason why they're doing that, and in the next few minutes, you're going to learn why and why it's so important for you and your family. Now, again, the vagus nerve is simply described as the longest nerve in the body, which originates as cranial nerve 10 in the brain, travels from the brain to the neck, then passes into important organs all throughout the body, including digestive organs like the pancreas, liver, spleen, lungs, heart. The vagus nerve is a key part of what's called your parasympathetic nervous system, which controls your rest and digest functioning part of your nervous system to counterbalance against the fight or flight function of what's called the sympathetic nervous system. So think about the sympathetic nervous system as like the gas. When you need to run from a tiger, it turns on, gets your heart rate up, gets you breathing hard, and then your parasympathetic is like, hey, calm back down. You have to be calm when you're digesting your food, or your digestion won't be all that good. So that's why it's called the rest and digest part of the nervous system. Now, the vagus nerve influences many different functions of the body with digestion, breathing, and heart rate, all of which impact your overall health. However, one thing you need to pay special attention to is the tone of the vagus nerve. Now, vagal tone, and think of tone just like you would think of like in a music, it's like tone or tuning, in an instrument. But vagal tone is an internal biological process that determines the activity of the vagus nerve. Now, what is vagal tone? Vagal tone is key to the activity of the parasympathetic nervous system, the rest and digest part of the nervous system. It is measured by tracking both your heart rate and your breathing rate. When you breathe in, your heart rate speeds up a little, and then when you breathe out, your heart rate slows a little bit. The bigger the difference between your inhalation and your exhalation heart rate, the higher your vagal tone. So when you have a higher vagal tone, it means that your body can quickly relax after periods of stress. The thing is, stress is going to happen. It's going to happen to everybody. It's how quickly can your body actually recover, and is there enough time for your body to actually recover? So, what are the implications of having a high vagal tone? Why is it so important to have a high vagal tone? Simple. Lower blood pressure, better blood sugar regulation, improved digestion via production of digestive enzymes, reduced risk of stroke and cardiovascular disease, reduced migraines, less anxiety, better mood, higher resilience. And one of the most interesting functions of the vagus nerve is that it reads your gut microbiome. And if you're not sure what that is, go back to the immune podcast from last month. We talked all about the gut microbiome, but basically it's the good and bad bacteria in your gut. So the vagus nerve reads the gut bacteria or fungus or virus that are in there, and it activates a response to control inflammation based on whether it detects a pathogen or a non-pathogen. This way, your gut microbiome can have an influence on your stress levels, mood, and overall inflammation. Now, what is the implications of low vagal tone? So this is what we don't want. Low vagal tone is found to be associated with depression, cardiovascular conditions like stroke, chronic fatigue syndrome, diabetes, cognitive impairment, higher rates of inflammation conditions including all autoimmune diseases, autoimmune thyroid conditions, endometriosis, rheumatoid arthritis, lupus, and so many more. Much research has shown positive feedback between high vagal tone and good overall health. But the more you can increase your vagal tone, the more your mental and physical health will actually improve. Now, Dr. Galubic, which is the medical director of the Cleveland Clinic, states that the vagal response reduces stress. It reduces your blood pressure and your heart rate, stimulates digestion, and changes the function of certain parts of the brain, and all those things that happen when we are relaxed. So this is not just some theory, pie in the sky thing out there by, some chiropractor that has a podcast. This is the medical director of the Cleveland Clinic saying this. And the Cleveland Clinic said years ago that the majority, like 90% of all the reasons that people go to see their doctor are basically from stress related illness. So, with all that being said, do you know that studies have shown that vagal tone can be passed on from mother to child? So, if a mom is depressed or anxious during her pregnancy, you tend to have a lower vagal tone or vagal activity. And then once you give birth, your child has a higher chance of having low vagal activity. Doesn't mean they're gonna, just has a higher chance. But also, that also can relate to low serotonin and low dopamine levels as well. All the more reasons why you should learn to strengthen vagal tone naturally, which is something that we're going to do in a later podcast. So, just want to set the stage. If you missed that first podcast, go back and listen to that one. Definitely hang out for the next two because those are going to be much more practical, boots on the ground podcasts in terms of what you can do on your own, really simple, at home, for free to help yourself. It's Dr. Jason Jones signing out. We'll see you on the next podcast. See you later. Bye-bye.